Pediatric cardiology is the specialty where we take care of the children born with heart condition, as well as the children who acquire the heart condition during their journey. Every child goes for the regular visits, and the parents feel that if their child passes out or complains of chest pain or their heart is racing fast, then that's the time to see a pediatric cardiologist to make sure that there is no heart defect. In other words, to make sure the pump and the plumbing is working perfectly. If the unborn child's father, mother or sibling were born with heart condition, then those unborn child are already at risk of having the heart condition. They need to see a pediatric cardiologist before they are born. The birth defects they are born with, the number has not really increased. However, the acquired heart condition is increasing due to the obesity and them being hypertensive and lack of exercise.